The No Surprises Act takes effect on January 1st, so meaning it's already in place. There are controversies around it, of course, because not all the parties are going to agree. The idea of the No Surprises Act is the fact that your insurance covers in-network providers very well. One way, you may disagree. But the reality is that while you're sitting there on the operating table, a new specialist could come in. And that new specialist could be an out-of-network provider. In which case, depending on the plan, you would have a cost associated with that consult, which you did not anticipate, thus the surprise. The No Surprises Act is out there to try to fix it. Of course, the specialist who's been called in wants to be paid at their rate. And then the controversies begin, because there's a kind of a mediation on what that rate will be. The issue is the fact that the carrier ends up with the bill, meaning that the difference between what the specialist wants to be paid and what the carrier wants to bill, wants to compensate that specialist, there's going to be a difference and a disagreement. So I'm not going to tell you that the No Surprises Act is bad. It's a good thing, meaning that it is trying to reduce the confusion amongst the very complicated process of trying to figure out what your insurance covered and what it did not, and what the price is that you're responsible for. The No Surprises Act does do that in part. Here's an extra fact to keep in mind. As a consumer, I try to tell people you should ask as often as you need to get this as clear as you can in advance. And here's the real thing, is that you need to understand that the providers also know this, meaning that for them, they would benefit more as an out-of-network provider, meaning that their amount that they would be paid, the amount that they'd be allowed to bill, is higher as an out-of-network provider. How extreme is this? I'd put it to you this way. I've seen healthcare providers intentionally elect to be out-of-network for Plan X, even if they themselves, for their professional practice, their group plan is with that same Plan X. In other words, the only conclusion would be that the healthcare provider is intentionally swerving out of the way to be an out-of-network provider to maximize revenues. As always, I'm not here to settle what's fair, these people should or shouldn't, what the world's supposed to be like. This doesn't happen in other countries. I'm trying to deal with the world that we have and try to avoid the confusion to the greatest degree that I can for you. Let's go on to the interview.
The No Surprises Act is now in effect, and here to talk with us about it is J.O., author of Maximize Your Medicare. Jay, welcome.
Thanks for having me, Bob.
Pleasure. So what do folks need to know about the No Surprises Act?
Well, Bob, as you know, as we've discussed before, the fact that price transparency from healthcare services is very, very difficult. In addition to that, when you're insured, sometimes what can happen is that you get provided healthcare services by an out-of-network provider without you knowing. As a result, the No Surprises Act was born, and that began on January 1st. It allows for people to have a very good way to dispute a surprise bill, and it allows a pathway by which you can have mediation so that you can resolve these types of billing disputes.
So what's interesting is the CMS.gov website has a fairly extensive review of the No Surprises Act. It reviews the rules and has fact sheets on what it covers. It tells you how to resolve these out-of-network payment disputes and what your rights and protections are. You want to talk a little bit more about what consumers can expect?
For sure, Bob. And I think that you've rightly pointed out that the CMS website, the link, that you'll provide is actually very, very helpful. It does lay out, in fact, what consumers can expect. I guess a couple of things that don't get very much notice or attention is the fact that even if you are uninsured, or if you're going to choose to pay with cash, then you are going to be able to be provided with a good faith estimate of what that price will be, trying to reduce the amount of mystery when it comes to receiving healthcare services for planned particular services. At least now you can have an estimate in advance, even if you have no health insurance.
So one thing to avoid these surprises is to get an estimate of what the medical costs will be in advance. Is there any way for consumers to do that, or is that sort of an effort that won't be met with any good results?
Well, I think that doesn't mean, I didn't say easy, right? So in other words, that the path to the requirement to provide you with a written estimate is now part of the No Surprises Act. So that, of course, is the good news. The reality is the practical reality of actually obtaining it and then going and doing the legwork to compare it. There isn't currently, as far as I know, but this can change, isn't a good place where you can go and comparison shop. For example, if you want to have an MRI, that doesn't exist.
Right. So as you look at the No Surprises Act, it seems like it's a great step forward. Are there improvements to be made in this act, or is this as good as it gets?
Well, there are always going to be hiccups. I think that can be anticipated, because while you're talking about the fact that it does provide relief for the insured persons who all of a sudden become referred to, or some particular lab test or some services provided without them knowing, it does now provide that first very important part of protection against such types of events. Once you get down the path, I do think, let's just say you do have a dispute. Hopefully it gets resolved without any incidents. That said, there's a very, very complicated set of appeals, and they run both ways, meaning that it's not only the consumer that can appeal a determination, but in addition to that, the healthcare provider may also be able to appeal whatever mediation decision is made. That is yet to be seen.
Right. So we covered a lot of ground. Anything we missed, or anything that bears reemphasizing?
No, I think that the takeaway here, Bob, is that it certainly is a nice step forward for people, because the fact is, for example, if you have an emergency situation, there is no way to charge out-of-network costs for emergency services, for example. In addition to that, you're going to be able to at least have reduce the mystery, if you will, when it comes to receiving healthcare services from a particular provider, even if you didn't talk to that healthcare provider. That can happen. And now, at least now, we have a path to understanding how the pricing actually works.
Well, Jay, as always, thanks for sharing your knowledge and wisdom with our viewers on this somewhat complicated topic. Much appreciated.
Thanks for having me, Bob.